let's get to know a bit more of some specifics, and like you guys have done, and I think you deserve all the praise for this innovation. Of course, the world is innovating as COVID-19 is forcing us to. Even the use of ventilators.
Yes.
Now they are doing split use. One ventilator is being used for as many as 4 people, and that wasn't the case normally. Right. So when we deal with the specifics, we want to know the number of samples that you may have dealt with so far, the number of samples you have processed,
So at Noguchi, as at yesterday, we had tested a total of, we had actually processed a total of 80,273. And we had tested 75,687. And of course, we know the positivity and things like that, the number of positives and things. So that was the broad picture. And of course, the government figures that it brings is not just Noguchi figures. It is adding KCCR. Now, Noguchi, we have trained the veterinary, VS, theirs will be added. We have also trained, what do you call it? National Public Health Reference Laboratory. Theirs also will be added. We've also trained CSIR. That one too will be added. So the picture brought by the government, arranged system is the global one. And if you compare it directly with that of Noguchi, you end up now having people becoming confused. And that has to be done very cautiously. Okay.
What sort of samples are you collecting? Throat swabs, sputum, stool,
okay.
And what's the advantages and disadvantages in either of these?
Again, you see, when you mention the ventilators, some few weeks or months back, if you made a suggestion that one ventilator will be used for 2 people, even just 2 at the same time, medical professionals will tell you that you are mad. There's something wrong with you. Because there could be cross-infection. But as you yourself, you said, necessity is the mother of invention. Now that we realize that if we use one ventilator on one person, 3 people will die, we find a way of using it on 4 people without cross-infection, because the concern is cross-infection. I feel you get it. Yeah. And we have already mechanisms and measures that we can use to avoid cross-infection. We have so many filters, different kinds, different types. There are filters we call HEPA filters that no pathogen can pass through at all. And it's already there and we know. So you can prevent the cross-infection. Therefore, you can do that. Now let's come back to the testing. The standard testing for COVID-19 required the use of the swabs.
Nasopharyngeal?
Nasopharyngeal, using through the nose for the back of the throat, and also through the mouth, also for in the close to the, a better inside. Now, when you take these swabs into the collect the samples, they are designed. They are not cotton swabs that are just brush like, They are specially designed, and they will pick mucus from the linings of the nasopharyngeal, esophagus, name it what. It will pick, mucus from there. And because of the nature of this infection, if you just brush a little bit of mucus, you are picking millions of viral cells, which is too much even for what we need for testing. So that's how come the test standard-wise is done. However, it got to a point that globally, there were no swabs. You can't get a swab to buy. The whole world. So do we fold our hands and say that, okay, no swabs, we can't test anymore? Or we will do exploration to see whether we can have alternatives. So what we did was then to again do operational research within program research, operational, and take the few swabs that we have which are available, use them alongside another type of sample collection that we already know. We have tuberculosis already in Ghana. We collect sputum always for tuberculosis. So what about collecting, because we want something from in there. What about collecting the sample as if we are going to do tuberculosis, examination or testing? And then let's check and see whether the swab and that kind of sample, what will it tell us? What will it give us? And that investigation showed that, look, the person who is positive by swab is positive by sputum. The one who is negative. So, you see, this is life. This world, you know what, I used to be the president of the Ghana Red Cross Society. We talk of first aid. One of the most important rules about first aid is that whenever you have to save life, you must be trained to the extent that you can use the materials that are available to save the life. Not that you say that, oh, I don't have a stretcher. You don't have a stretcher. What do you mean you don't have a stretcher? You can make a stretcher with shirts and sticks. I hope you get the point. Yes, that is what science is. And that is what we do. We have to do it because we are supposed to be creative and create science ourselves and introduce new methods and approaches. So it is important for the public to understand what is the University of Ghana Noguchi Memorial Institute for Medical Research, and understand that we can do new things and introduce new concepts.
Good. So some people are interested in knowing whether even with the innovation that you have introduced, you still are challenged in a way or the other. We have discovered suddenly that there are quite a number of institutions in Ghana who can do some of these testing, except that, we didn't plan about them, the nature in which we neglect our health institutions, leave them in a state that they are unable to do as much. Yet this situation is forcing them to do a lot. For the first time, I'm getting to know about the National Public Health and Reference Laboratory, all of them doing some of these things. What challenges are you facing by way of the capacity questions?
Okay, so let me talk to the innovation and challenge, and then I'll come to that. So as you introduce innovation, of course, you introduce also new challenges or problems. One of the challenges that we have encountered, which is not a difficult thing to deal with, is where you collect the sputum, and the sputum is put in a container like you saw the VSD, and sometimes some people who are packaging the sample are not capping the container well and can allow a leakage. But unfortunately, anytime there is a leakage, any other sample together with that leakage cannot be tested or analyzed, because we cannot tell whether the leakage contamination has taken place, you see. So that is one challenge. Now, apart from that, you find that it goes fairly smoothly. Okay. And then the second part of your question, can you repeat that for me? So the second part, yes. So
I was just seeking to know what are some of the challenges that you would face, you're currently facing.
In terms of the capacity building.
Yes. And you have made us also know that you are supposed to also help all the other institutions, as it were. And we are getting to know that there are pockets of these institutions around the country, but they just have been neglected. And I mentioned the National Public Health and Reference Laboratory, for example, who are also doing some of these, but what's the capacity? How much can they do? What help can they get so you can free up Noguchi and KCCR?
Yes, and that, yes. So some of the very interesting capacity challenges we have had is, first of all, certification. Before any other unit can join the COVID testing, we should be able to certify the personnel who are doing the testing, and also the facilities they are going to use to do the testing. So training, going to the site and training the people there is okay. But to certify, you need to have more information to be able to be sure that I guarantee that this person will do an excellent job. One thing we have done as far as that is concerned is that people who will do the analysis in the various units, we let them come to Noguchi to work with us for a period of time as part of the training. So they also see what happens at Noguchi and have first-hand, experience. And so that one has helped us to overcome that. The other second very interesting but unique challenge is that if you come to Noguchi, University of Ghana, Noguchi Memorial Institute of Medical Research, and you see the way we work and the way we are set up, we are expected and obliged to meet international standards. So there is something called Quality Management System, QMS. And then other, accreditation, good laboratory practice, ISO, and things like that. QMS, for example, is so critically important because to handle samples like COVID-19 has so many biosafety issues. Even the laboratory scientists, the personnel working in the testing themselves can be exposed through unintended, release, or name it what. And so it is so important that even the unit that is going to join the testing meets a certain criteria. And sometimes you may find that there are so many other units who could have joined, but they cannot because they will not meet the quality criteria.
Okay.
So one of the other things we should do, which WHO has already started, building the capacity of laboratories to be able to meet quality standards. It's a very important thing generally for laboratories in Ghana. And there are so many laboratories who don't meet standards, especially some of the private ones. You see.
All right.
Things like that.
On this note, we will take our very final break, and when we return, we will hear from Bright Simmons. And there's, is it a question from Charles Rekobrobe? He says that, can Bright Simmons use that big brain to build a unique Ghana COVID-19 model using the real data he has so brilliantly dissected, so we don't have to be scared by the output of whose hypothetical approach? We'll be right back and we'll hear from Bright.